My name is Gurpreet Singh. I'm an orthopedic surgeon. I practice in the Musculoskeletal Institute, and I'm an assistant professor with Dell Medical School. So my patients will be usually patients who are experiencing hip and knee pain. I treat degenerative conditions of the hip and knee, and those could include osteoarthritis, inflammatory arthritis, post-traumatic arthritis, or avascular necrosis. I will also see patients who've had a prior hip or knee replacement and they're having a problem with it. Hip and knee replacement are some of the most successful surgeries that we do in the field of medicine. Patients who are dealing with hip or knee pain, they're often not able to walk, participate in their activities of daily living, and being able to help those patients feels very rewarding to me. Good healthcare to me is patient-centered, it's evidence-based, it's affordable, and easy to access for the patient. When I'm seeing patients for a hip and knee joint-related problem, even though they're seeing a surgeon, doesn't necessarily mean that they're going to get offered surgery. The treatment is really tailored to what the patient needs, and a lot of times we can treat hip and knee related problems with non-surgical measures. And I believe in a holistic approach. So sometimes the treatment could be physical therapy, sometimes it could be medications, injections, or a weight loss program with our dietitian. So I grew up in the Sikh faith, and there is this concept of seva within the Sikh faith, which translates into selfless service. I've always really resonated and connected with this concept, and being a doctor allows me to do seva.